So we're in a fluid-filled model, okay? So no, always hold the butt of the syringe up so the air rises. You're drawing back. Draw back from the patient, aspirate. There you go. You're trying to clear any air bubbles. Flick it right there. Good, okay. Amari, pick up the control syringe and manifold. And so you're gonna you're not flushing in. You're gonna, and especially air. If you were gonna flush in, it needed to be like this, so the air rises. Because if you're like this, you just about put an air embolus into the patient, okay? So you wanna keep it in this position. All right, now, just go ahead and remove that syringe. And what we have to understand is that blood would be backing out because the heart's beating, it's forcing blood into the catheter. You're gonna pick up this part of the controls of the, don't do anything yet, listen to me. I'm gonna tell you exactly what to do. So Amari is going to give you some flush. So you would have blood coming out of the catheter, and we're gonna have flush coming out gently. We're gonna do a fluid to fluid connection. So go ahead and start flushing and start connecting. Okay, make a tight connection. Now, we stop. We don't inject anymore because there could be air right here, and we would inject that straight into the patient. So this is where we're gonna do our first aspiration or drawing back, okay? So you're gonna draw back. You're gonna tap it here. Some air is gonna come. We would be getting blood. You need to be tapping it here. Here, because this is where bubbles are gonna be sticking possibly. You would be getting, because we had some air because there was no backflow. So us sitting there too long caused some air to come in. So keep going as far back as you can go. The purpose here is to pull any possible air and to see good blood return. Okay, now we have still some bubbles, but you can't draw back anymore. So what you need to do is open your waste port and just push some of that out so you have some room in your syringe. A little bit more, about halfway. Okay, and draw back again. Continue tapping so that those air bubbles rise. Move your catheter out of the way. That's why we note the catheter, move the catheter. Okay, good. All right, once you know and you feel real good and that's good. You no more bubbles are coming back. You have all your air here. Then you're gonna flush forward. So that first, I use AFFP to try to remember. AFFP. Okay? So. Okay. That's okay. Good. Okay. And don't touch anybody on the shoulder, because is the shoulder sterile? No, it is not sterile. Okay, so now you're gonna do your first F, which is your flush forward, flush back to the patient. This has got a lot of blood in it though, but that's fine. We're gonna give their blood back to them. Our purpose here was to clear any air, really.
Do I hold this or put it on the...
Doesn't really matter, yes.
Does it matter how fast you flush forward?
No, but you don't want to take all day. The doctor's going to be waiting on you. So she did okay. Stop right there. Now you're going to do a second F, which is flush again. So how do I flush again? I got to get more flush in my syringe. So now you're going to draw flush down from your bag, fill your syringe. Okay, now turn the flush back off and flush that straight to the patient. We're air free already, so we don't need to hit it, anything, unless we see a bubble, which we shouldn't if we've done everything correctly.
There's a big one in there.
Yes, I know.
Yeah.
You're never going to inject that into the patient, okay? But the doctor's not going to like that, so we are going to want to get that out of there. But at this point, we now need to automatically turn to pressure. So we can read pressure from the patient to the transducer. This transducer should have also been turned open after we've zeroed so that we can, and Amar, you've got to keep that hand up. There you go. It's okay. Just think about that it needs to be at table level. You can't drop it down by your side. Okay? And so now we're in the aorta with this tip of this catheter, so we would be seeing our aortic waveform going across the screen. on a 200 scale. If we have it on the correct scale, we should if we know what we're doing.
At what point do we turn it up to pressure? Like
After we have zeroed.
Right, but when we start doing this,
After we have zeroed,
okay,
the circulator needs to turn this to pressure.
okay,
You can't do it because it's not sterile.
okay.
Now, unless you're at a lab where they keep it on this side and they have the holder behind the plastic and you've kept your transducer sterile, then you would be the one. As soon as we've zeroed, and we do that as we're setting up.
Okay,
Once we've plugged into the electrical cord here, we tell either I as the circulator will go over and hit the 0 button on the computer, tell it to 0 or calibrate. We see that it is zeroed, then we'll come and turn it to pressure. Now it's not going to read a pressure until we actually have this connection, but we go ahead and turn to pressure, that way we're ready when we do connect. And pressure will automatically pop up on there. Is that what you were asking about?
Yes, I just wanted to know at what point.
Yeah, we can do it as soon as we've done our calibration, our 0. Okay? And so the next step would be the recorder would record that waveform, all right? Save it in the digital system. Now we're still seeing it, okay, because it's live. But what we do is we record kind of like a picture of it, just like it would print out and look something like that, but with only the aortic waveform. This has got simultaneous LV and AO, okay? And so then we're in there with a Judkins right, we're gonna be shooting the right coronary artery. So the next step would be to draw up contrast in my syringe so that I'm ready to start injecting the coronaries.
Okay, so I'm gonna.
You can get rid of that flush and that bubble, yep, and you can just push straight out, okay? And then draw up some contrast, a full syringe of contrast. Uh-huh. Tap it so that bubble rises, good. Full syringe. And then of course I would have to push some through the tubing and the catheter because right now it's all flush in there. So in the lab I would open up, I would squirt about 2 cc's. By that time the doctor is probably saying, give me a test. And they've stepped on fluoro and they're wanting to see contrast, like when I did the injection on the simulator, they're wanting to see the contrast come out. So they can tell where they are and if they've got the tip of the catheter in the ostium of the coronary. Then you automatically fill with contrast. So the whole time we're in there, once you've injected some contrast, you're drawing contrast right back up. But you're also, every time you inject the contrast, you have to turn pressure off to be able to inject. So turn it off. We'll pretend like we just injected. As soon as you're done injecting, turn it back on to pressure. And then you would draw up more contrast. Be ready for the next injection every time. Now once we're done injecting whatever coronary we're injecting, then that's when we're going to do that catheter exchange. So you would disconnect from here. Go ahead and push that back up into your contrast bottle for me. For now, the contrast. And you would either, this is contrast, you would either pull the catheter out if you weren't going to do an over-the-wire catheter exchange, you're going to preload, or you would wait for her to give you the wire and do the over-the-wire catheter exchange. So grab your wire, let's do an over-the-wire real quick. Or you guys, if you need to leave, you can leave, but because it is 1 o'clock already. You're gonna give her, just hand her the J-tip. She's gonna put it in. And what you're doing is trying to have that catheter that wire come out of the tip of the catheter. So just keep going, going, going. The doctor would step on fluoro. You would see it needs to go a little further. It needs to go up. That's good. Now start pulling the catheter out and advancing the wire. Now hold here. Let her have the catheter. Finish pushing the wire in. Amari.
Oh,
Mm-hmm. Okay, pull the catheter. You're ready to grab the wire. Okay, finish pulling the catheter off, wipe the wire. Don't worry about the catheter, wipe the
Oh.
wire.
Don't worry about it. Okay.
No,
Okay, so let's take this off.
but control that wire so it doesn't flick off.
I'll put this over here.
Come back and wipe your wire from here.
This one here.
Wire staying in the patient. This is not winding and pulling it out. There you go. Now we're ready to load the next catheter on. Okay, so get your next catheter, and this is what we're gonna do for our procedure for our practical. And I'm gonna practice with each one of you hands-on when we come back after Thanksgiving. On that day, So you keep, every one of you, almost every one of you, keep moving this hand back. Hold on to it right here. Nope, you're moving that hand.
Oh,
Hold it and don't let go.
oh, hold this.
Yeah,
And
Oh,
see this one?
yeah, but don't pull it.
Yeah, come to me.
There you go.
Oh.
your feet with that hand.
Yeah,
I kept
like we
catching
did.
myself doing that, and then I was
But
like,
you,
stop, wait.
yeah, you,
You're telling her when you have wire, don't go in all the way with that catheter until she has wire. How can you see if you have wire if you're not,
Yes, I
there you go. Tell her you have wire.
And
Now,
one.
go together as a unit.
Together.
Just hold the sheath and just feed it with one hand. Wire's going up, and actually wire's in the ventricle, so we're gonna pull, because it's a short body. So just, pin your wire, yep. Go ahead and advance your catheter. All right, stop, catheter's in the ventricle actually right now, so that's okay. Now we're gonna pull, wipe, and wind. The last lab did a wheels on the bus thing with it, making their loops or something. Bunny ears and wheels on a bus. I don't know, whatever it takes,
Yeah.
okay? Just twice, don't do too much. Tuck it under your towel. Pick your manifold up, get you a little bit of flush again. You go ahead and draw back a little bit with your syringe. You're gonna need some room to pull back. That's too much flush, you can't aspirate, only 5 to 6 cc's every time when it's the flush for the connection. Little details, I know, but those are the things you've got to be thinking about. What am I doing now? How do I need to have it ready?
Do I flush in? or,
No,
aspirate?
Remember?
I just aspirated, yeah.
and keep the butt up, because that bubble needs to stay here, nowhere near going in the patient. And you aspirate it,
Mhm.
okay? Do a quick disconnection and pick up here, get ready to connect. Give her some flush, wait till there's some flush coming out. Give her some flush, okay, connect. Make sure it's nice and tight, aspirate. Start flicking,
And this one, oh.
flick it here. Good. There's bubble coming, you're good, there. Still bubbles. Draw back a little harder and hit it hard with your hand. There you go. Gotta make those bubbles move. If they're just sitting there, All right, bubble free, except for up at the hub, and that's good. Flush forward. That's your first F. You can go faster. Drop a syringe of flush.
Okay.
And you can flush again to the patient. And turn to pressure. No, other way.
This one?
Yep. And now we're ready to see pressure, and then if we're doing the left coronary, drop contrast, do it all over again. Okay, because the pigtail, we don't drop contrast. If we're gonna be hooking up to the power injector, we'll just then connect to the power injector. But we'll worry about that next semester. That's as far as, if we can get that far this semester, we're okay. Okay? All right, so go ahead and pull that out. Everybody else is cleaned up. I will worry about this if y'all just finish everything else up. I'm just gonna clear all this real quick. I do it really fast, so not that you guys can't do it, it's just